Hey, great Monday evening. It is a beautiful day in the city of Brownsville. Just a nice, weird kind of Texas day in the city of Brownsville in regards to weather. We did get a little bit of rain, a little bit of sunshine. Hey, Paul, man, how you doing? Hello, Guinea. Paul, good evening, guys. Just real quick, we did get the numbers in just as we were signing on. Good evening, Joe. How's it going? Guadalupe, good. Just to let y'all know, 374 uh, positives for Cameron County, 207 positives for the city of Brownsville. Six more deaths have been reported by Cameron County. Again, guys, not true. Fake numbers. Not true. And, we're going to talk about the numbers again tonight. Leah, Gloria. Frank, my man, how's it going? It's rock and roll. It's just the numbers are very, very upsetting, guys. Very, very upsetting. Gentlemen, good evening, guys. Flip the board 100%. We're going to have Ida Aveldano from AOBE come on at 10 o'clock. Hopefully towards the end of this program, we'll discuss a little bit of what went on today at the board meeting. So everyone, after we hear from Dr. Saavedra, I know that there's a lot of questions out there for Dr. Saavedra. As soon as we hear from Dr. Saavedra, then we're going to have, a quick 30 minutes, 45 minutes with Ida Veldano at around 10 o'clock. Dr. Saavedra is still here. Ida might have some questions for Dr. Saavedra. But besides that, I'm sure a lot of individuals are interested in knowing what's going on. Are we done with hurricane and back to Corona? Yeah. Yeah, we're done with Hannah for a while. I think it's done and over. I think there wasn't much that happened with a couple of houses. I guess to the people that it happened to, I mean, it was a lot, but just not what was expected. So again, we did good in that respects. It could have been a lot worse. Not that much fun.
Thank God, Erasmo. I was without power for almost a whole day. Luckily it wasn't that bad. Iowa Street did get it pretty bad. So luckily it wasn't as serious as we anticipated. We did get some much needed rain, much needed showers. But other than that, everything seems to be okay. We've gotten past the worst part of it. But I guess I guess it is back to COVID-19. So we were expecting hurricane season to hit. It's been a while since we've experienced one. But 2020, Erasmo, has been one for the books. So we do not need another hurricane, at least not yet. Let us get through this year, and then we'll hopefully down the road deal with something different.
Yeah, Frankie isn't at McDonald's tonight, but I'm actually kind of craving one of those Happy Meals. I should have actually gone pick one up today. And we do have Dr. Teresa Saavedra with us now. Dr. Teresa Saavedra, how are you doing tonight?
I'm doing great. How are you?
Doing good. It's good to see you again today.
Yes. We got to see each other more than once today already.
Yes. And what I mean by that, guys, is we did have, the blessing to have Dr. Saavedra speak to this morning at today's board meeting. And, I was hoping, Dr. Saavedra, that you would be given a lot more time than you were given. But, we do appreciate you, coming on here especially, but also, addressing our superintendent and our school board, letting them know your concerns. Is there anything other, I know that they did cut you off this morning, and a lot of individuals were very upset because they did want to hear from you. A lot of our school personnel want to hear from you. Is there anything other that you wanted to share with the board that like the part two of your speech this morning, Dr. Saavedra?
Well, they cut me off at actually one of the most important parts of what I was discussing. And let me tell you, 3 minutes does not even scratch the surface of the discussion we need to have, medically speaking, about the coronavirus in our community. I mean, we're making national news, especially Hidalgo County. I mean, Starr County, they're in the Rio Grande City area, unfortunately, having to decide whether to keep people in their hospital or send them home to die at home. So it's not that that's a million miles away. That's in our backyard. So the reality is that we need to listen to the medical professionals and to truly be able to have a good conversation about it. And I was really taken aback. I was a little bit disappointed, to say the least, that I came in with the expectation that it was going to be a conversation between the school board members, the superintendent, and myself, because I'm an expert in what I do, and I'm, willing to share my opinion freely. It really isn't because I wanted to get accolades from the school board. It really is because of a true concerned citizen that just happens to have an expertise in medicine that needs to have a discussion, because I care about every single child in Brownsville, every single child in the Cameron County area. And I think it's very important that we open that dialogue together. But to answer your question, basically what happened is that while I was researching a little bit about what's happening, I realized, and I think I was able to get a little snapshot that you had agreed with me as I was saying it, that children, unfortunately, aren't being displayed by the health department in the right categories. They're lumping them together from 0 to 19 years old instead of putting them into elementary school, middle school, high school, where a judgment can be made by the school district in an educated manner. And remember, we're talking from educated professional to educated professional. The BISD professionals should be educated enough to understand that if they don't have the right material to make a decision with, they need to ask for that. And that was one of my points, was please ask the health department for better materials in which to make a decision. We don't have to agree. My opinion as a medical professional doesn't have to be what the decision is of the school board. That's not the intention. The intention is to share information so that we may be able to come together as a community to make a best decision for our children. These children are our future. They're not to be put aside. I mean, my boys are small, they're 2 and 4, but they are going to be in school one day. And will I want to choose BISD as a school district? Because it is a choice, it's a choice to have. And so to me, and Frankie and I had a lovely discussion earlier about this, BISD is on display. What they're doing now are going to shape parents' decisions in the future as to whether they're going to send their child to BISD or whether they were going to say, you know what, that's too risky. I don't know about those trustees there. I don't know about those board members, because they're taking risky decision making. So I feel strongly that we really need to look at the data more on the children and what they're doing, how they're getting infected in our county specifically, and what we can do to improve on that. So that needs to be instigated. If the BISD isn't getting that kind of information, how can they make a good decision? They can't. It's just impossible. So they need to ask that question. And if they don't ask that question, they're doomed for failure from the beginning. So that's number one. But also, we need to continue to not think that we know it all. Not me as a professional, not them as BISD, but we need to open the dialogue within the community as well and ask others what we could be doing better as a community to help make our situation improve. Why are we failing at decreasing the cases? What are we doing wrong? Are we not knowing enough about coronavirus in general? Now, as most people know, the scientists are learning new things on the daily. We know new things every single day. Every day, CDC updates its guidelines on what healthcare professionals are supposed to give as guidance to our patients. And that literally changes every single day. I mean, just last week, 2 weeks ago, we were talking about being able to talk to people about stopping quarantine within 10 days or with 72 hours without a fever. Now it's 10 days or 24 hours without a fever. So those guidelines can constantly update for reasons that the research is getting better and better and better. And we're learning more and more and more. But remember, we're coming together as a nation, and internationally, scientists are sharing data like they never have before. Never have before. scientists traditionally are very, very prideful about their work, and they don't want to share their discoveries. But in this situation, in this world right now, we have to, or we are doomed for failure. And this is what I really believe, that the BISD should take that kind of approach. Instead of them thinking we have the answers, we know everything, we don't need to know anymore. Remember, this is like the president and his cabinet. The president needs an advisory board. The president doesn't know it all. We know that. And he's not going to, and none of them will. None of them, regardless of if you're Republican, Democrat, liberal, it doesn't matter. But they do need advisement from the best. And that's what we need to do, is open that dialogue about what people on our team in the Brownsville area can we utilize in a positive way to be able to get to the best outcome possible. And,
Well,
that's, yes.
No, I'm sorry. And again, I was very, very concerned because something that you touched on is just very, very important. You see, we want to hear, and that's one of the reasons we're so very, very grateful that you, Dr. Eder, Dr. Mario Cerdan, other Dr. Madi actually take the time to come on here because, again, I've always said it, out of respect, y'all times is golden. I mean, y'all are working so hard to help save our community, to be an asset to our community. And, y'all have families as well. And, we take a little bit of your family time to come on here. And we greatly, greatly appreciate, the community greatly appreciates it. That's why this morning was so disheartening. Part of my concern, Dr. Saavedra, is that, the numbers that we are getting from the county are not in tune with the numbers that we are receiving from the community. It's really at this point county versus community, because the numbers that we're receiving from the community let us know that there's a lot more people that are falling prey to this disease, a lot more children falling prey. There's a lot of people who are actually dying at rates that are amazing. That are not being reported in the county numbers. Today it's 6. That's why, Dr. Saavedra, I wanted you to speak. I was very excited that you were going to speak before the board, because the board is basing their decisions, Dr. Saavedra, on the numbers that the county and the state are giving them. But there's not the actual numbers that we are experiencing here in the community.
No.
And they're making decisions that impact the lives of 43,000 students, 6,600 employees, and they're sending our employees back onto campus. I mean, it's so irresponsible, Dr. Saavedra.
It is. And I was a little bit taken aback because I really haven't been treated like that as a professional. I was shocked. I was a little bit flabbergasted. I thought, my goodness, did they just dismiss me? But it's honestly, Dr. Hernandez and myself, we're not the type of people that take that lightly. We take our responsibilities very seriously. But because we have a lot of passion for what we do and we love our community, we love being a part of it, we want to be enthralled with it and to make it better. Even if it's just a small piece of the world, it's our little piece of the world. So, we do it with joy and we love it. But we want to make sure that even if they are dismissive, Dr. Hernandez and I, we do plan on discussing with the board through an email so that they do understand in writing what our recommendations are. Whether they silence us through that meeting or not, we're still going to be heard. The reality is that I believe the rise is coming up with the people. I saw some of the comments that some of the people made. They were upset. They said, why are you sending my children? Why are you sending me? Why are you sending my mom, my aunt, whomever? Why are you sending teachers and students back to an unknown world in school where they could potentially not just get sick? We're not just talking illness. We're talking potential death. So it is that serious. And while I know that the school board wants to be dismissive of it because of the fact that there is money at stake here for them, on the state level, on the city level, we're looking more than what matters with money. We're looking at human lives, and those are precious. So I think people are going to really start getting some momentum here, that if the BISD isn't listening, there's going to be such a rumble coming up in the community that we won't have any choice but to listen.
Amen,
Hi,
doctor.
Peter Hernandez. Hi. Some of my patients are saying hi to me.
Doctor, we heard from the superintendent today, advised that he was practicing social distancing. They were disinfecting certain areas. Do you think that's enough for the district to provide PPE and be disinfecting? Is that safe for administrators or teachers to go back onto campus?
I don't think that it's enough. See, the problem is we get used to our surroundings. We are creatures of habit. We're humans. And over time, we get used to what is common in our areas. So we're going to start off really excited and really highly disinfecting areas. But unfortunately, as time progresses, we're going to get a little bit more relaxed, and eventually, just like my example, the kids are going to want to take off the mask if it becomes too hot in a heat wave in Texas. And how many kids are going to do that and cause infection in another kid? How many kids are going to start off disinfecting everything from top to bottom, and then eventually they're going to be like, oh, it looks fine. And that small decision, which seems so insignificant, is going to become so significant in the life of another family that it may just cause someone's death. And nobody really wants that kind of commitment on their hand, that kind of gravity. We really want to prevent that. I mean, prevention, they say an ounce of prevention is worth a pound of cure, and that's extremely true. We really need to be thoughtful in our decision making during this process before tragedy strikes. We don't need to have a child die for this to become important. We already know that it's important. So it's really it's not a small matter. It's a very serious matter, and I'm glad that both of you are bringing it to light. I think the community has come to realize that plenty of your words are indeed true. Unfortunately, I got to see it firsthand, just how insignificant that others might seem in front of the VISD. I'd like us to all be able to have a seat at the table, because remember, they're in service positions. Maybe the superintendent and the lawyer are hired, but the board of trustees, they're all elected. And, come October, November, there could be a change if they really are that serious about continuing in the same path they're continuing down. And that's not a threat, because this is more of that eventually, the people will rise up when you make them upset enough to see that their wishes aren't being known, that they're being stifled. The people will rise up and they will make a challenge. So we have to be careful and make sure that we're doing it for the right reasons, that we're not just being selfish and self-serving, that we're truly serving our community with the intentions that were originally placed.
Amen. Dr. Savera, one of the videos that was out today there was a couple of videos, I think, on Breitbart in regards to some doctors. And I did get a question. Emilio from Karate actually posted the same question. A group of American doctors spoke outside the Supreme Court today and said that the drug hydrochloroquine, along with other meds, have helped patients with COVID-19 and has also been used as a prophylactic. According to these doctors, it has been a very effective way to treat COVID-19. What is your opinion in regards to this protocol? And has this protocol been used with the patients here, especially with the increase of infectious and death?
That's a very good question. Originally, when Donald Trump had made the claim that hydrochloroquine was an effective and good medication to combat the coronavirus, it was seen somewhat positively, although there was some grumblings in our medical community about there being some concerns about it. Now, what ended up happening, as we've discovered over time, and probably the rheumatologist knew best, because hydrochloroquine is traditionally a medication for rheumatoid arthritis and lupus and things of that nature. But it came to be known that hydrochloroquine has a half-life of 40 days. It's quite long, which is really not typical for most medications. Also, hydrochloroquine has an ability to affect the insulin and sugar levels, that balance, and which is very tender, and especially in our particular community, it's a very striking need to pay attention to that. And there's also heart implications. So there could be something called QT prolongation, which causes an arrhythmia or an irregular heartbeat that could be potentially fatal. So hydroxychloroquine, in my opinion, at this point, I won't use because of where in our community that we have too much heart disease, diabetes, and other unfortunate comorbidities that make our population less likely to be receptive to that. Now, maybe in the proper community, they could be a little bit more easily used, but in ours, I stopped using it. I had used it on a couple of patients in the beginning when it was a potential for having some safety, but also some potential for saving our patients, but not currently. Now, the more exciting medication that I want to be more useful with is ivermectin. I don't know if anybody has heard about that. I know Dr. Hernandez and I, we've been using it regularly on our patient population, but ivermectin, which is a well-known common antiparasitic medicine, but also has antiviral properties, has shown quite a bit of promise, and also decreases the replication of about 40% less on the coronavirus. And we usually typically dose it by weight, but also give it over 2 divided doses over a couple of days. And that seems to really stop the coronavirus in its tracks in a lot of ways. So that, with a combination of some steroids and some antibiotics to check any inflammation markers or secondary infections, seems to be the current excellent treatment for patients. And this isn't just the United States. I know in the United States, we're a little bit more scared to use ivermectin, although I'm not really sure why. I think because most people are a little offended because it's a heartworm medication. But it's not just given to animals. We do actually give it to humans as well. But in Peru, they're having amazing success with it. They are doing really well. I mean, whole communities are being saved. They're using it as a prophylaxis or a prevention dose in order to prevent getting it from the start. So it is a way that we are using for treatment right now. So that is really I think the current great medication to use, which is cheap and effective.
Awesome. Dr. Saavedra, one of the other things that was mentioned, and John, I'm not dissing your questions. I'm trying to compile them all, and we are going to talk about the death rate in a little bit. So don't worry, John. I promise you. I love John. John's good. But one of the things that those doctors were saying was that in regards to a lot of the studies that were going on throughout the world, that children were not passing it on to other individuals. That they'd be, it's asymptomatic, that a child didn't run the risk of passing it on to a teacher. In your research, is that true? Is that even factual?
That seems extremely false. I mean, coronavirus right now, I haven't looked at the recent transmission rate on how infective it is, because there is a ratio epidemiology wise that they continue to track. I know right now the contagiousness of measles is more contagious than coronavirus, but I know that coronavirus is fairly contagious. However, I do
Technology. Again,
sorry, I apologize.
it's okay. Technology. Sometimes it's amazing.
I
Sometimes
got caught up there.
you're back.
So yes. So I know that it's contagious on the coronavirus, and it's less contagious than measles, but to say that children can't get it or give it or pass it, it really has no truth to it. I mean, we're seeing it pass to cats and dogs. Cats and dogs, I was reading, have the same rate of transmission as humans do. So if cats and dogs can get it, what's the difference between a little human and a big human? I think that we would be really mistaken to believe that it could only be transmitted by adults and not children. I think that the children actually have the potential to transmit it a little bit more because they touch everything and then they touch us or their parents. So I think that the rate of transmission could potentially be argued it's more, not less.
I would tend to agree with you, Doctor. I mean, again, a lot of individuals are making mention of it, and I mean, I think a lot of individuals want to push a certain narrative. And again, what I hate, Dr. Saavedra, is that when they start to interject politics into the matter, and look, I know that a lot of what's happening is politics driven. One of the things that changed in regards to the CDC guidelines, and I truly believe it was because of the insistence of the president and the White House and their task force, was to change the CDC guidelines in regards to going back onto campuses, going back to school. And I hate when that happens. And I've made it very well known to people here. I am a conservative. I have a lot of conservative values, as many other people here in this area are. But I'm
Mhm.
sorry, I don't believe in sacrificing anyone for a political party. I don't believe in political parties at all. I don't care for the Republicans. I don't care for the Democrats. I care for the candidates who are going to be out there doing what is in the best interest of the people that they're elected to serve. So, with that
I agree.
said, Dr. Sabina, you've heard the recent change in the CDC guidelines. What is your take on sending kids back to school?
I still think it's a mistake in most areas of the country. I mean, I know that not all areas of the country have this same rates of increase of cases, increases of deaths. So not every area needs to be blanket statement for that, because there are some areas where it's not touching quite as much. But for the areas that are at a certain rate of transmission, we need to draw a line and say, hey, at this rate, don't send your kids back. Be really careful. They need to start making those kind of recommendations and guidelines. Because if we say, oh, well, everybody's okay to go back, well, then what's the point? Why don't we just all go back to work and not wear masks too? We can't put it all in the same bucket. We have to be careful and be thoughtful in our choices. And no parent wants to send their child over to school thinking they're needing to get a good education just to see that they come home and they're sicker than they've ever been. And you're worried that they're never going to make it. I mean, I was just reading before we came on, in my home state of Florida, where I'm from, there's now a fifth child that's died. They're like 9 and 11 years old, formerly completely healthy, no medical conditions whatsoever, that needlessly are dying. And this is before school. This kid is a beautiful, sweet 9-year-old girl, a sweet black girl that no previous conditions, didn't go to summer school, didn't go to summer camp, didn't go out and do anything. And they have no outlet to understand why she passed from the coronavirus, because they don't know how she got it. Can you imagine if we go back to school and to start parents pointing fingers? No, your kid did it. No, yours did it. I mean, that's harsh. That's the harsh reality that we're going to come to, because we love our children fiercely and we want to keep those children. We
Amen.
want to protect them, and to think like, oh, well, your kid touched my kid and look at what happened now. That's a too hard of a reality. I think that's too heartbreaking to have to make that choice. We need to be very careful.
Doctor, we've heard about a vaccine in the works. Is this going to be our new norm? I know this is hypothetical, but if we get the vaccine, are we still going to have to live the way we're living now? Maintaining social distancing and wearing a face mask and potentially not having large gatherings at schools?
I believe that we're still going to need logistically to hold the line. We can't possibly do the vaccination all at one time. We have to do it logistically, group by group. We're going to take the people with the most critical need to get the vaccination, and then we're going to go down the line and say, okay, well, who's the next most critical and who's the next? That will take time, and it'll need to be done through certain mechanics and logistics. You're going to have to stockpile the vaccines. You're going to have to be able to figure out how you obtain that vaccination, not just from the patient standpoint, from the supplier standpoint. So all the way down the line, they're going to probably have challenges, just like we are now in all these industries, on what's going to be the bottleneck to make the vaccination possible for a large group of people. And then we're going to be able to disseminate it over time. But during that time, if we all think, oh, thank God we're saved, a vaccine is here, but then we stop social distancing and we don't wear that mask quite as often and we're not washing our hands as much, then we're going to start seeing those rates still climb and climb and climb, and we can't afford that. So we have to assume that at some point we may have people that get the vaccine on day one or in that first few months, and we have people that don't get a vaccine for up to 12 months. So I'm thinking that what we need to do is we need to continue to practice what we have been doing all along, which is to do that social distancing, wash those hands, wear that mask, do the uncomfortable stuff now, and just make it the regular thing. Talk to your children about it. And, I tell my kids that there are buggies outside because they're too little to understand. Even my son knows the word coronavirus. Gosh. I mean, it's that common around the house now that he knows what it is. But as long as we are going forward and still reinforcing the good rules of trying to be prevention with infection, I think that we'll do really well in keeping it at bay until there's enough herd immunity. And what I mean by herd immunity is enough people are vaccinated that there's going to be very few people that end up getting the disease because we all have enough immunity from it that there are going to be very few cases that are new that are uprising. So that's what a vaccine is traditionally intended for, is to get herd immunity. And that's what we're going for. That's what the holy grail is right now, is to get that herd immunity from COVID. But I think we have to be in it for the long haul, and to say that, in December everybody's saved, I think that that's a little bit too soon. I think we're going to need a lot more time.
Just to answer John, to ask John White's questions in regards to the deaths, is there a certain age group out there that is more affected by deaths? One of the things that we heard from President Trump's cabinet was from the Secretary of Education, Betsy DeVos. She made mention that we shouldn't worry because only 0.02% of our students would probably die from coronavirus. I guess she didn't do too well in math at her public school to know that that's like 15,000 students. Right. And again, if one is too many, 15,000 is madness. With that said, is there a certain age group that is now more prone to succumbing to coronavirus?
It's always been by age, most of all. The 85-year and older are the most likely to pass away. Their rates are, I want to say they're in the 80%. Like if you get it and you're 85, the likelihood you're going to pass is like more than 2/3. And it's unfortunate, but that's where they're concentrating so much in the state of Texas on the nursing homes, and usually around the country as well. But I know in our state that they're very concerned about the nursing homes being a part of the vulnerable population. But as we get a little bit younger, if we talk about age groups, the 70s and 60s are going to be your next group versus your 50s and 40s. Your least likely to pass away are going to be your youngsters, but it's not zero. As I mentioned last time, no one wants to be the parent of that one child that, despite the fact that the likelihood was low, that they still passed away because of some unknown reason. So one is still too much, but yes, it's less likely in the kids.
Dr. Saavedra, one of the things that is very concerning to a lot of individuals here in our area is that, we just went through Hannah, and we did okay, with Hannah.
We did great. I was like, Lord, we're going through COVID. Now Hannah too.
Good.
But,
what else?
God knows what he's doing. I think we're very resilient as a community. We're tough as nails. And I always make the joke that God doesn't put anything harder on us than we can handle. So he must think we're really tough if we can handle it. But it was a little challenging to get that much rain. It wasn't too much, but it was enough. I'm a native Floridian, so I was like, Cat 1, no biggie. I went through a Cat 3, so that was scary.
Y'all used to getting multiple ones.
It was a little bit tough.
With that said, one of the other concerns is that we're closely approaching the flu season, And Dr. James Wittenberg is asking, couldn't you get the flu and because your immune system would be low, you also could get COVID and have both at the same time? Are we concerned that the flu might weaken individuals to the point where they'll be more susceptible to COVID?
James, this is an amazing question, and you're absolutely right. You hit the nail on the head. Yes, we're approaching flu season, and this is what most all medical professionals have cringed at, because we hit COVID in March when we were at the tail end of our cold and flu season. And for those of you that don't know what cold and flu season is, like how it lasts, it starts in usually late August, September area in 1 year, and then completes itself in usually April, May of the following year. We get about 3 months off, 3 months off of having flu season per se. But with the coronavirus, knowing that we had it at the tail end of our one flu season and when things should have been ramping down, and now knowing that we may be getting it again and it may be ramping up, but now also with flu, it's like a nail biter for us, because we know what flu season holds, and flu season in general, we always need to give flu vaccines. And it's always a hard sell on my part as a primary care provider to tell people to get the flu, because many people here believe the flu vaccine causes the flu. Let me tell you, my lovely Brownsville community, Cameron County, the flu vaccine doesn't cause the flu. Your immune system ramps up. You do get similar sometimes, and not always, but some people will mount a larger immune response to that flu vaccine, but similar fashion to what coronavirus vaccines will be. Your vaccine is not a live vaccine. It is it's taken out of the live version. It's called a dead vaccine, and you are just injected with enough piece of that virus for your immune system to recognize that it's not native to your body. And so basically, whenever you receive that vaccination, your body's going to say, hey, that's not for me. And it's going to amount to an attack. And some people amount a small attack because you've seen it before and it doesn't need to mount such a big response. And others mount a really big response. And so that's where most people will get their immune response from. And many people will misinterpret it as the flu. Now, I have heard anecdotal stories of people that say every year they get a vaccine for flu is every year they get that type of immune response, so they just stop taking it. But it's very rare, it's very seldom, it's very random, and I think for almost all of the population, very few people need to reject the flu vaccine. And I do highly recommend that if you are considering on whether to get the flu vaccination or not this year, and I told this to people last flu season, and I will say it again this flu season, please, the coronavirus is still here. And if you do have a potential to get both the flu vaccination, and when the coronavirus vaccine comes out to get both, because especially for our diabetics, for our hypertensives, for our people with issues with weight and obesity, those are high risk groups. After age, as we were talking about, the second highest risk group is your people that are overweight and obese. So please be careful, everyone. It's group 2, and we do have quite, I believe the rate I saw was 34% rate of obesity in the valley. So that's 1 in 3 people walking around are overweight and obese, which is a second reason to get COVID and have it be more moderate to severe.
Doctor, we recently got word that the city of Brownsville limited the occupancy space to 25% for restaurants, gymnasiums, and the bingo parlors. In your opinion, is that sufficient enough during these times?
That's kind of relative, because you're talking about 25% of what number? If the bingo parlor is holding 1,000 and you're saying 25% is only 250, that's still too much. I think that our churches and our larger gatherings in general, we need to be very careful on how we hold ourselves. And we need to make sure that if you're having a group that's more than 10, technically speaking, you're not doing what the ordinances are saying, because you're not supposed to have large group gatherings. Now, I know people are still going to church because they're saying that they're protected. And look, I'm a Christian. I love Jesus just as much as anybody else. But at the same time, I don't think God wanted us to all go to church and potentially infect each other with a deadly disease that makes half of us pass away. So, and I know that the rate isn't that bad, but if we do have a percentage that get infected and die, I think that risk is too high. So we do need to be careful. Now, if it were saying, if you had a group of 20 and you only did 5, well, maybe, but depends on how far you're socially distancing as well. Because if you're in a very small enclosed space, it doesn't matter how many people it is. If you're less than 6 feet apart, you're going to potentially get it. So it's all relative, not just based on like the percentage, but we're talking actual numbers and how close in proximity you are to each other. The virus is transmitted through coughs and sneezes and talking and singing. So all those things that we typically do when we're around other humans, we talk, we converse, we relate to one another, but that can be pretty deadly.
Doctor, anyway, my question is, what neurological side effects are you seeing? Also, when and where are you opening? Oh, when and where are you opening your office in Brownsville?
Thank you for your question, Tess. I'm from Florida too. I'm from Jacksonville, North Florida, right next to the Georgia border. So, the neurological side effects that we see most often, and most people know this one because it's such a weird one, is the loss of sense of taste and smell. That is a neurological effect. Neurological effects are things that affect the nerves. Cranial nerve 1 is going to be your olfactory nerve, and the sense of taste is a special sense. I think it's actually cranial nerves 7 and 9. But there's a couple of nerves for the taste buds, the special sensation of taste. But those are both neurological sensations. So those are the most common and the ones that are kind of the buzzwords for, hey, go get tested. But there are also less common ones. Now, the ones that are less common is you can get tingling and numbness. That happened with me. I don't know if I shared with you, gentlemen, but I unfortunately did get coronavirus over the last couple of weeks. Thank God my immune system was really strong. I was able to handle it fairly well. But unfortunately, one of those weird side effects that I did, and I honestly am not sure exactly where I got it, so I can't appropriately contact trace from it. But I did get weird tingling in it that was kind of awkward, just these hormigueos, these little weird sleep feeling, So that's one of the less common ones. There was like a stinging, burning in the nose. I'm sure that was related to the olfactory nerve. And then the ones that are the most deadly that are neurological symptoms are for strokes, for clotting and strokes, which they're seeing the paresthesia. I think one of the teachers, the music teacher, Erica, I think she had gotten some of the neurological side effects. Very scary to get that. And does everyone get a neurological symptom? No. Do you have to have any of the symptoms? No. That's one of the things I wanted to share with everybody tonight. Is one of the top 5 things that you should know is that everybody's symptoms are different. Do you have to be textbooks? I always joke, does your body have to read the book? No, not at all. You could have 0 of the symptoms, but know that you have had exposure, and people that are completely asymptomatic do test positive all the time for coronavirus. So that does happen. But you could also get just one symptom. You could get a myriad of symptoms. Most people will get the typical symptoms, your majority, but there are some people that get the less common ones. So we hope that we're not part of that group in our community, that we get just the typical ones that seem to go away. I got the loss of sense of smell. That's how I knew at the end of the day. At first, I thought I just used a nasal spray too much. But I ended up losing my sense of smell, unfortunately. And that's when I said, uh-oh. And I tested not just myself, but my entire family. So thank God nobody else was positive. It was just me. I don't know how that happened, but glory to God, everything worked out that way, and everybody in my house is safe. So.
Well, thank God. That's a very relieving for a community who's desperately in need of more and more of our doctors and our nursing staff and all our medical personnel. Doctor, would you recommend the new vaccine to a person that has had kidney removal when I function on only one kidney? I have that question ready for my urologist this week, but would enjoy your input.
Okay. Eva, thank you for your question. I am not sure. I need more information. Usually, with every vaccination, there are guidelines on people that should take it and should not, depending on how the vaccine was made. And because it's so new right now on how it's getting made, and you're talking about RNA viruses and changing out the way that the vaccination is encased and other specifics on the technology, we may not know until right before the vaccine is made if there are implications in transplant patients. Most transplant patients for people with kidney transplants won't be able to get any type of vaccine because they are immunosuppressed. Now, if you have kidney disease in general, it doesn't necessarily rule you out as not being able to get the vaccination. But we do have to be careful because there may be the incident that you get a higher chance of clotting if you use the vaccine. And for some people, that might rule them out because, there are some vascular implications in kidney disease. So it just depends. But we would need a little bit more information. But continue to ask your urologist that question as well. They may have some data I don't have. But I would say to continue to look for the information to see if that's something that you qualify for.
Dr. Ed, now this know in regards to infections happening in funerals. Have you meditated or heard of that as well?
In the beginning, when I started reading about it, I do have a friend from medical school that's a pathologist, and I read about the implications in pathologists and in medical examiners, and those implications are huge. I am not sure exactly how the pathology and the medical examiner community are dealing with that right now. I do know that there needs to be special infection control even with the dead. So people that are getting put into those trailers, those refrigerated trailers, because they're dying so quickly in our areas, unfortunately, here in the RGV, we need to be careful because, yes, if you're mishandling a person that's already passed, they may still be infective. Now, remember, the infection doesn't last the entirety of the 2 weeks that you're infected. You're most infective before you show symptoms and at the beginning of symptoms. So thank God it's not the entire time, but we don't know if some people mount such a huge immune response in the beginning, depending on their immune systems, that they die with having an active shedding of the virus. So we do have to be careful. We're still learning so much about the disease on a daily basis that we still need to define more about how exactly the transmission is passed and all the routes of transmission, whether it's just by sneezing, coughing, talking, or, I've even seen implications from fecal transmission through the use of toilets and things spraying up into the air, unfortunately. So that's not as fun to discuss, but it's possible, and we need to know all routes of possible transmission. So,
as we know, Texas is football is king in Texas. UIL just released its modified schedule, allowing volleyball and football practice to begin next week, August 3rd. What's your opinion on that, and what recommendations do you have for parents?
Volleyball is less of a contact sport, but football absolutely is a contact sport. I think that's a mistake. I really think that parents and college goers that they need to be very careful on deciding in their participation in contact sports, because we don't know that that close proximity isn't part of that transmission. And I'm not saying that everything you touch could be possible coronavirus, but you know, sweat happens when you are an athlete, and you also do a lot of heavy breathing. And I'm sure that that respiratory droplet is a lot more easy to transmit from one person to the next when you're hot, sweaty, and breathing hard. So it's really something to watch for, and to really, you know, make an educated decision, because I know that they're college athletes and they're on scholarship, and this may depend on whether they get a good ride or not, or whether they have to find alternative means to continue on with college, because that was their ticket to get a, you know, a paid for education. But you know, sometimes you have to make those tough decisions because it's the right thing to do. It may not be the easy decision, but it's more than likely the right decision to hold out or wait for a different season, or see if you can delay it, you know, for a year, and maybe just pay for that education or go part-time for the year, instead of doing the contact sport. For football specifically, volleyball, it's not as much contact, but it's not no contact either. So that that is a little slightly less concerning, but still you're in an enclosed area in a volleyball gym typically. I mean, they're not doing beach volleyball, from what I know. So that's where you kind of have to say, is that going to be worth it? Because are there going to be spectators? It's not just the volleyball players, but the volleyball players plus the coaches plus all the support staff of the volleyball players and coaches that get everything together. So we're talking about, again, gathering of groups of people in large masses, because that'd be at least 50 to 100 on a typical volleyball team on both sides of the game. So I would say that that has to be, really have to look at that and see. I mean, I would love to see the data, if they do decide to do it, on what the potential for transmission was post each game.
Dr.
Mhm.
Appreciate it. Please discuss the definition of inconclusive for COVID results.
So inconclusive really is kind of a code word of, we can't prove it's positive, but it's more than likely gonna be positive. So it, even though it's not positive per se, it's close enough to where we highly suspect it will be, if it's not now, or that it has been. So I think it just hits that a certain threshold on the testing where it kind of falls into that more than likely category, but not 100%, if that makes sense. But yeah, it's a more than likely it will turn out positive. So treat yourself as positive. Unless it says negative, it's not a negative.
And let me tell you that. Let me ask that. So that there's a lot of concerns from a lot of individuals, and actually, you know, that it's taking a while for them to get their test results back. So you know they're kind of concerned. Is there a reason why there's a backlog in regards to giving individuals their results? And is it? I mean, is it an issue if they wait 10, 14 days and then find out they're positive when they could have started treatment during those days?
So it's a really good question, and I do try to educate the patients that I speak to on this and why it's happening, so that they're aware, because I think setting an expectation as a practitioner is really important for your patients, because, you know, we're all anticipating like what those results are going to be, and the practitioners and the patients alike. The reason behind why the delays are happening, number one, and first and foremost, is the need for the exam to begin with. The uptick in our area of the coronavirus testing ramped up very quickly, almost overnight. With that happening, we only have so many labs in the state of Texas and in the area. LabCorp, Quest, CPL, those are some of the main labs that get tested. And some of them are better than others. We do have one locally at the university as well. And basically with that, some of the testing centers are quicker than others because of the capacity that they have. Some of them only have capacity to test, a certain number at a time, while others have a capacity to test hundreds at a time. So it just depends on the volume that the lab is able to test and what's possible for that lab to produce out per day as to when the patient actually gets those results back. And then sometimes just out of sheer, just like any test, it's logistics. So sometimes the tests get bunched in with a different one, and one gets put in a different day than the other. So sometimes they get stuck a little bit further behind than the others. That does happen. I've seen it plenty of times where one that should have been out several days before is, put at a further down the line, unfortunately. And we do try to trace that regularly and to prevent that as much as we can. But of course, it is hard with the volume.
And
I see
do want to
someone's
say
joined
that
us.
we do have AOBE Ida Aveldano here with us, AOBE organizer. And Ida, I just wanted to welcome you
Hi.
on and see if you had any questions, Ida, for Dr. Teresa Saavedra.
Well, first, I want to apologize again. I am so sorry about this morning. I really did not think it was going to come out across that way. I was really hoping that we were hoping to build that bridge and that the district was going to be a lot more receptive, especially because seeing everything that, you bring to them as far as information. I mean, you're in the front line with that. So I appreciate everything that you do and your positive attitude that you have. I mean, you were just amazing. And I thank you again. So I can't thank you enough for it.
Oh, thank you. I really thank you for inviting me. I really appreciate it, Miss Ida. The opportunity to represent the community at any point is a huge honor for me. I love what I do, but I also love our community. I really am invested into the RGV. So I just, I want to make sure that we do the best that we can and use the knowledge that we have in our area. So thank you for what you do and to be a voice for all of our educators, because I know right now they definitely need a voice. I just want to give a little ray of light to everyone. I don't believe that coronavirus is going to last forever. So I know that we're all fatigued. The battle fatigue that's happening right now is real, and there's a lot of mental games going on with coronavirus. I myself, while in quarantine, found myself realizing that if I didn't win the game up top here, that none of the wellness would happen in the rest of my body. And I want to encourage anybody that is facing any kind of illness, but specifically with coronavirus, to make sure that you are, realizing you don't have to live out the diagnosis. Yes, you could be positive, but your body is amazing and capable of handling so much more than we even realize. I mean, God made our body super intricate. So we can indeed, many times, most of us who do get the coronavirus, not only will get it and pass with flying colors, but will live to help others that deal with it. And I just want to make sure that if anyone does have the coronavirus, please reach out to your family or your friends. Don't be, cowarding backwards. Make sure that you reach out, because there's a lot of doubt that goes on in our mind mentally when we know that we're potentially sick, and because of all of the news that happens around with coronavirus, we can really get scared that we're going to end up in the ICU. I hear that a lot. Most patients that I talk to say, "Doctor, please don't let me go to the ER. Please don't let me go to the hospital." So thank you for being that voice for our educators, because I know that part of who I am today comes from every single teacher that's ever taught me. And I have a lot of love and respect for every teacher. I still remember my kindergarten teacher, Miss Wyatt. So I really love my teachers, and without them, we wouldn't be where we're at today.
Exactly. And we're not going to stop. We're going to continue to push forward, and hopefully some common sense will sink in but we're definitely not backing off of them. In fact, it fuels us even more because they have to realize they need to put some medical professionals on this task force. So sooner or later, it will happen.
And I would be happy to direct them again. I think Dr. Hernandez and I would both be willing to have a more candid discussion with them. I would argue that it would the forum that would be better would be more of a conversation where we're able to discuss back and forth rather than a timed 3 minutes. I don't think that really gives that enough breadth and depth in a 3-minute conversation about coronavirus.
Exactly.
But I would be happy, and I'm not offended. It's possibly what their current what their setup is with the BISD on how they do their meetings, but this is a special kind of meeting that requires a little bit of outside of the box thinking, and we're going to need to do innovative things, and to be amazing at what we do, I think we need to do things we haven't done before. We can't do what we have been used to. The traditional ways aren't going to cut it right now.
That is right.
To do more.
Well, one of my concerns, Dr. Saavedra and Ida, is we've been pleading with this board, we've been pleading with this superintendent for months now, pleading with them. Please bring in our doctors, bring in our scientists, bring in our frontline fighters, our warriors out there, and let them tell you what we are seeing out here in the community. What happens, Dr. Saavedra, is that there's such a disassociation, están tan apartados, tan lejos de la gente, que they don't comprehend or understand the fears and anxieties that our people are feeling. And when that happens, how are they going to make the decisions based on the wants and the needs of the people that they supposedly serve? A great example, Dr. Saavedra, and I don't know if you were at present. A great example is Port Isabel. Port Isabel had to make a choice in regards to their student population and their staff, and they said, you know what? Hell no, we won't go. We're not going to send anyone back onto campus. It's a 100% distance learning from now until next school year. And I think that's very, very commendable. But we did have, I know Dr. Eder Hernandez was out there and he was sharing that information. See, that's what we would hope that our elected officials here in the city of Brownsville would do as well. Bring in the professionals. And Dr. Saavedra, there is no one more professional in regards to fighting this coronavirus disease here in Brownsville. So from Brownsville, and Dr. Eder Hernandez and yourself, y'all have been on the front line of all of this. So for us, it's very, very disheartening. I know it is very disheartening for a teacher association who actually also got those phone calls regular. Am I completely off, Ida?
No, I mean, we couldn't believe it. And we got a lot of messages today, and it was really, I was so embarrassed and upset, and it was not what we were expecting. Yes, we didn't think there was going to be a full presentation on the virus, but we were hoping at least to start building that connection and that relationship, and so they could see what you and Dr. Hernandez were willing to offer. And you guys have always been willing to help as far as informing the public. And we commend both of y'all for that. You have an excellent attitude and a giving spirit to be willing to do that. And as tired as you guys must be, I mean, my gosh, if I'm tired, I can only imagine how tired you all are. But that's what we were hoping for. And they have to listen sooner or later, because they cannot develop an effective plan without having input from medical professionals on there. And, you're not going to get a full effective plan just by educators on there. So hopefully we're going to continue to push for that. And sooner or later, it'll get across. I mean, we're rubbing them the wrong way. I know that. We're upsetting a lot of people. I know that too. And I believe somebody mentioned, I saw the message about that some of the board members gave praise to the other associations and not us. and and that is fine by me. That is fine by all of us, because we're not here. We're not here to make friends. We're here to do what is best for the members, and for their safety. And if they can't handle what we're trying to do, and call out the mistakes that they're making, then that's on them. This is not personal. We're talking about people's lives here.
Yes.
And just because we weren't giving them positive feedback the whole time, I believe that's what one of the board members said, that the other associations were so positive. Well, if they were handling it right, we'd still be pinpointing the things where we can improve. And right now, we are so far from it being handled in the best manner possibly out there, So, if they don't like it, well, then I'm sorry. But we're here to represent our members and to advocate for their safety. And we will continue to do that.
Well, one of the things that I think, we were talking, Dr. Saavedra, in regards to politics, coming into play of a lot of the things. And, one of the things that I've always said, if you surround yourself with yes people, you're going to make the wrong choices all the time. You have to have independent thinkers around you who are going to, where you can improve. This is where we think it's becoming a mistake. Andrew Miles, the frontline workers need to be involved and ask for our feedback 100%, because they're going to tell you the truth.
Exactly.
They're going to tell you the
Yes.
facts. They're not going to
Yes.
tell you what you want to hear. And Dr. Saavedra, I don't know your medical practice, but I know that there's a lot of times, Dr. Saavedra, I just because I know the field, there's a lot of times that you've told people things that have been uncomfortable for you to tell them, but they
Oh,
were the
yes.
truth. I
Yes.
mean,
We're commanded as medical professionals that we try to do it with grace, and we try to do it with compassion, but we need to tell others the hard facts. If we sugarcoat it, we're not being true to our profession. And as we all know, some of the best friends you'll ever have are the people that give you the tough love. Those are the people that are going to tell you the truth, even when the truth hurts. So I do think we need to have a kind of tough skin right now, like you were saying, Miss Ida, with the BISD, and let them know, like, yeah, I know that you're hurt.
Yeah.
I acknowledge that you don't like what we're saying, but we need to say it, because if we don't, unfortunately, lives are at stake, and if we don't say anything, only more lives will get lost. So we have to be the bearers of bad news, and maybe we're not that fun, association that gets to say the positive stuff, because, well, we need to service our members and be truthful about it. But we are right. Just because it's not a popular statement doesn't mean it shouldn't be said.
That's correct. That's right.
And it's important.
well,
Absolutely.
one of the things that we dealt with today, as Frank is making mention, mental health issues. It is an increase. It is increased by individuals who don't follow guidelines because they think it's a hoax. And
Yeah.
unfortunately for us, the president of this board, has stated out there publicly that she thinks this is a hoax. It's politically motivated in order to re-elect the president. And again, here we go into bringing politics into something that should not be political in any way, shape, or form.
Correct.
The most important thing out there is to keep our children safe, to keep our teachers safe, to keep our staff safe, to keep our community safe in return. Am I
Absolutely.
confused?
You're
Guys,
absolutely correct on that. Yeah, and we all need to do our part. And if it makes us the unpopular person in the room, then so be it. But you know what? If we were able to save a life, hey,
amen.
then it was worth it to me. So we're going to continue to do it. We're not going to back off. Doesn't matter what they think, or if they're offended, then I'm sorry. Then we need to toughen up, because this is real. I mean, this we're going through a real thing that is affecting a lot of people. Okay, even the ones who recover from it, as we've seen with Erika, it's still a long process for them.
I thought, what was your take on the superintendent saying that I'm here every day? All we have to do is just wash our hands and practice social distancing, and everything will be okay. What was your take on him mentioning those words to the administrators and the
It
teachers that are
shows,
coming in next week?
yeah. To me, I
This week, sorry.
believe that shows why some of the decisions have been what they have been, because he thinks it's it's as simple as that. Yes, washing your hands, it's going to help a lot, and all of that, but also we need to see what else we can do. And what we've mentioned from the beginning is to let the people work from home if they can work from home. Hey, yay, she's back. That is something that is very important, and he refuses to do that. And so, oh my gosh, is that a turtle?
It's a turtle from the Galapagos.
Oh.
So, but for him to say that, oh, yes, I'm here every day and I wash my hands and I'm fine and this and that, you know what? He's fortunate enough to be able to do that, but he's not working in a crowded office as some other people are doing. And I'm sure he didn't have any of that expired hand sanitizer that other employees had. So, and like I said, we're going to call it out as it is. Yeah. And I'm sure that's probably one of the reasons that they're very upset. But if he would answer the emails, then we wouldn't have had to have gone that route. It could have gotten taken care of. And it's a shame that it took 2 weeks for them to send out an email. They never acknowledged that it was wrong, but it took them 2 weeks to send out an email saying that they will replace the expired hand sanitizers if they return them to the warehouse. That is unacceptable. I mean, come on, guys. 2 weeks? Are you going to be using an expired hand sanitizer that smells horrible for 2 weeks? I don't think so.
And it's ineffective. But it's kind of very, very pompous, Look, and again, I'm always tooting our doctors' horns, but look at goodness gracious, I've seen our doctors, I've seen our nurses out there. They get down in the nitty gritty, it's not always pretty what they go through every day. I actually went to get my little I went to get my little thing done. My little tooth fell off, my crown or something, and I went with Dr. Rios out there, and let me tell you, she was down in there with, like, she looked like an astronaut. And thank you to Dr. Rios
Yes,
staff
they
out
do.
there.
And
Yeah.
that's gonna work on post-COVID. Yeah, and they look like they're about to walk on the moon.
Yes. And, Dr. Rios, thank you so much for seeing me. Thank you to your amazing staff. I love Dr. Rios. She's been a great dentist to me, and a great staff out there. Very, 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 very awesome. But our doctors, they get down in the nitty gritty. They get their hands right in there. They do their stuff. Long hours. They're exposed constantly. They are essential. Let me tell you, Ida and Sareda, a man sits in a golden palace, a glass palace, on the third floor with a private restroom, a private little kitchen, a lone office where he can do social distancing with 20 other people in there. That's not an essential worker. That's not someone that you could compare to one of our doctors, one of our lunch ladies, one of our custodial staff, one of our teachers that is actually hands-on, and they're fighting this hands-on, guys. And it's at that point when people start to believe themselves more important, than what they are. And our doctors are servants. Our doctors are servants, and they lead by example. That's what we need at BIP. We need leaders that will lead by example. But sitting in a glass palace is not showing anyone that you are an essential or you're important. And actually, someone put up the comment. One of my good friends made up a comment, says, by his comment, we just learned who wasn't essential for our district.
Ouch.
Dr. Saveda, anything else that we need to inform the community in regards to COVID? 19?
Well, as far as COVID at the current moment, we, like I said, we're still learning so much about the coronavirus that things change daily. So we need to stay tuned to the changes that are happening because it changes every single day. Every single day. So make sure that you're looking at the recommendations. The recommendations are always evolving, our how we get people back to work again evolving. Like I said, it used to be 2 weeks, now it's 10 days. It used to be 3 days without fever reducing meds, now it's only 24 hours without those fever reducing meds, and that symptoms have gotten better in general. So it's not the 2 weeks it used to be before. Make sure, COVID is a mental game first more than it is even physical, because not everybody captures all those symptoms. So make sure you're reaching out mentally to your friends, your family, professionals if you need to. If you're not dealing well, if you do get the coronavirus or a loved one that has it and you're not dealing well with their illness, because I am seeing a lot of mental health issues arise out in the community. Don't do it alone. Please get help. Even my brothers and sisters in the healthcare profession are getting battle fatigue from treating a lot of patients with coronavirus. So that is real. I think Dr. Hernandez has talked about it before, that healthcare professionals are experiencing the battle fatigue and getting overwhelmed and unfortunately committing suicide. So hi, Georgia. Miss you. So also just make sure that you're staying tuned, because again, the treatment plans change. Ivermectin's in right now. Maybe in the future we'll have an even better medicine that'll be that silver bullet. So be open to that. Know that there is treatment, that you don't have to go home and accept just take a cough medicine and write it out. That you can ask your healthcare professional for them to treat your symptoms and to treat the potential for co-infections. And then, pray a lot and make sure to support your community. Support our friends here at Erasmo and Frankie in October, November. If you like what they are saying, if you like that they're wanting to have the community continue to be at the forefront of the decision making and it not be I believe 100% that like you said, doctors, teachers, we're all in service to our community. I wouldn't be here if it weren't for the lovely people in the Cameron County area. I don't know what I would be doing, but I love what I do, and it's because of having wonderful patients that we do what we do. So we need to be service oriented first, for sure. And so anyone that shares that agenda of being service oriented is amazing in my books, and we need to continue to support people in that way. So thank you, Erasmo and Frankie, for all that you're doing, because I know it's bringing quite a bit of light to what we need to be concentrating on. If people didn't know before what kind of community leaders they had, they're starting to realize it now. And if they like it, well, they'll vote that way in November. And if they don't, well, hopefully they'll help make that change come November.
I appreciate Dr. Savera. Doctor, is there a connection? And I think I know the answer to this, but of course, it's your wheelhouse. A connection between COVID and the rise of Kawasaki disease with children.
More than likely, the rise in Kawasaki disease is just more. It's a Kawasaki-like disease that kids get with COVID. They do get that 105-degree temperature, and that is Kawasaki disease with the strawberry tongue and those terrible fevers. They do need to be treated fairly aggressively. And it is more COVID. It does present similar to Kawasaki disease, but again, it's a viral related illness. So it's similar to, but not exactly the same. But I think it's driven from coronavirus. So I think you could probably say it's more coronavirus than Kawasaki. It just makes a similar presentation.
Well, Doctor, thank you so very much. Uh, we're going to discuss a couple of the votes with BISD today. So you could stay around if you'd like to discuss them. Ida's going to give us some insight in regards to them. Great, Ida. What did we learn today at the meeting, Ida?
Oh my gosh, we learned in those 10 hours that, but to be honest and to be fair, I did step away for a few hours from the meeting, and I didn't get to see if they presented a safety plan. I am
No,
hoping that maybe no,
no,
they didn't. They didn't go
no,
over that at all.
no.
Wow. I was hoping it was in that section when I stepped away and we did the show on our the other show, but it is that's a shame. I do have to commend the directors of some of the departments. They did present some information as far as the distance learning option and things like that. But my main thing and what we were pushing for was that we wanted a full safety plan with the complete procedures and protocols that are going to be followed when there is a positive case or there is a positive possible exposure. And we want to know what the employees are going to do and what's going to take place to sanitize the place in order for it to be safe again. We keep hearing a lot of things that it is going to be 100% distance learning. So they did say that today. I know that look at Erasmo. So, but that is what they said. But they keep encouraging people to go and work out of the classroom if they want to, that will be available. So I don't know how many people are going to be doing that, and that's where our concern is when we don't know the safety protocols that are going to be followed. You know, we've seen, unfortunately, recently a custodian that passed away. We don't know if it had anything to do that she didn't have proper PPE, available to her. So that is a big concern to us, So we're hoping, and if they did not present that, then we're just going to continue to put pressure on them about that, because we are 4 months going into 5 months into this already, and this is not acceptable that we don't have full protocols in place for what happens when there is a positive case and or possible exposure. It's unbelievable, and that's why it gets so upsetting.
Let me tell you, I was disgusted because to me, 100% distance learning means actually 100% distance learning. And I'm sorry, I don't agree that 100% distance learning is having our children being at home. For me, 100% distance learning is what Port Isabel did. No one goes back on campus. No one. That to me is 100% distant learning because it covers all 100%. And I'm sorry, the disregard that they have for our personnel. Look at, let's call it the way it is. They announced the individuals that had passed away at BISD today. Did they even acknowledge that they had passed away from COVID-19?
No.
They did not. They did not. They are not addressing the matter. They are not addressing the issue. So it serves very little purpose to go out there and say, well, my condolences to this family, to this family, to this family. Say the words. Say that they passed away because of a coronavirus, because of COVID-19, because they were exposed to it on our campuses. Say it. Look it. I understand the legalities of it. I understand, and everyone out there needs to understand that they were probably coached by the attorneys. Don't say coronavirus. Don't say COVID-19, and that's why none of them have mentioned it. But goodness gracious, they shouldn't put themselves in a situation where they could, have a lawsuit filed against them by not sending anyone onto the campuses while we're in the middle of a novel virus. Goodness gracious, why is that so hard? Why? Look at, my friend John here is making mention of, well, how many 20-year-olds are dying? How many 40-year-olds? And Dr. Edna said it right. One is too many. One is too many. Well, how many have to pass away at BISD? How many of our staff, our personnel, have to die at BISD for them to take notice? For them to shut it down. Shut it down. And Dr. Saavedra, I mean, we've heard about it being airborne, the ventilation system, and all these things. I mean, am I incorrect in saying at this point we just don't know? We don't have enough facts in regards to saying that sending them in there is just way too soon.
Oh, absolutely. I mean, I was so moved hearing about our BISD coach that came on and to tell his story and to share with us his experience. And I mean, my husband was sitting beside me, and he was to hear all the symptoms that the coach, I think it's Coach Joe, right? That he was experiencing, and that he was still in recovery. I mean, just tremendous example of how can be so very life altering and a negative. Careful. We have to be very affect just us. They affect a lot of people around us. So ventilation systems are a big deal. We do need to be careful and look for ways of keeping the air clean and pure. Because this is a respiratory transmitted disease by air droplets. So yes, it's important.
Ida, I'm sorry, Ida, and I'm sorry that you all got disrespected today. I mean, of everyone out there that's out there fighting, I mean, y'all are the only ones that are calling it the way it is. And you know what? I think our community is ready to hear the facts. Our community is, and they're so used to this politicizing of things that that they tend to do things that are not in the best interest of the community when they don't have the complete facts of what's going on out there in our area. And look, I feel for a lot of my teachers out there and personnel and staff that are associated with other associations, and I feel for them because they really truly trust. But if anything was evident out there when Prissy Roca Tipton and Little Eddie went out there saying, "Oh, Patrick and Alegria are doing such a great job, they're positive." But we don't need positive. We don't need everything is peachy keen in Brownsville. We need the truth. That's all we need, the truth. And then by posting the truth, let individuals make informed decisions of what's going to happen. Life is not all roses and handsome people like Erasmo, unfortunately. There should be more handsome people like Erasmo. Ida,
yes.
y'all got called out for not being positive.
And it's okay. And they can continue to call us out on it as long as this virus is, at the state that it's at right now. That's fine. Like I said, we were not going to back down. And if it helps to save at least one life, then we will continue to do it. And it's, like I said, it's nothing personal. It is, no matter who would be on there, if they were making the decisions or lack of decisions that they're doing right now, we would call them out as well. So it's nothing personal against them. It's what they're doing in the seats that they're currently holding. So, like Dr. Saavedra said, they need to develop some thick skin, and let's all work together and come up with a plan that is going to be effective. I really doubt that this plan that they put out today is going to cover every single thing possibly out there, but we'll see. We're going to review it, and then we'll take it from there.
Ida, TEA allowed 4 weeks of distant learning. Is there something that BISD could do to get another possible 4 weeks? Do we have that option?
Well, that's the thing. We had that question earlier, and TEA offered the 4 weeks with the possibility of an additional 4 weeks with a waiver. But the resolution that BISD approved is to continue the distance learning until it is scientifically proven that it is safe to return to the workplace. I'll be very honest with you. I don't think they realized what they approved, because it's going to be a while before you can scientifically prove it is safe to return to the workplace. But we will hold them to that, and we'll see how that goes. And I think if they have to backtrack from that, it's going to look really, really bad, or even worse than what they're already looking like up there. But that is what they approved on the resolution. So
well, they look pretty bad already. I got one more question for each of you, and then we're going to call it a night. Dr. Saavedra, what do you think about the action that the city of Brownsville? I guess Dr. Wells is in charge of Brownsville EMS division. Dr. Wells is in the medical director. Dr. Wells directive to the medics on patients experiencing SOB. I hope that's what I think. Okay, because of COVID-19 will not be transported to the hospitals or a higher level of care, then the patient should just be left at home to fend for themselves.
That's inhumane. That's scary. As a medical professional, we took a Hippocratic oath: first, do no harm. If someone's short of breath, that clearly means that they're in distress, that one of their vitals, meaning it's vital, it has to happen, aka your breathing, that it's at risk, and they need to be evaluated. So being left at home, it depends on what they're talking about, like how short of breath they are. At least by telephone right now, what I'm doing is I'll evaluate them and ask if they can count as fast as they can all the way to 20. And then depending on how far they get, I'll determine on whether that's short of breath or not. If they can't even get to 10, well, that's short of breath. So unfortunately, I can't put my stethoscope on everybody right now. But there are other ways to evaluate. We get creative. But we do need to still take every concern seriously. I mean, that's what we're here to do. We're here to assist, to help, to advise, and to reassure people that their symptoms are manageable and what they should do about those. To dismiss them is to be not only inhumane, but it's malpractice. So I don't really agree with letting people fend for themselves, so to speak. I'm not really sure what the words that were said, but I'd have to see the context of what Dr. Wells was talking, and what respect that was. So I'm not meaning to disrespect anybody, but if it's just fend for yourself, that's a kind of a strong statement.
I agree. And I'll use this one. There was no plan reached just to pay 40 hours. Can you explain to us real quick what that vote was for the 40 hours? There was some confusion because I did mention classified. What really happened with those 40 hours?
What Dr. Gutierrez mentioned on that was that I believe he's going to have he's going to change the schedule, and they're going to be they're going to be working less hours. So I think they're going to have early release, and with that resolution that he had approved is going to be to make sure everybody gets paid the 40 hours, even if, let's say that they get out at 2 o'clock or 3 o'clock, because he's going to be changing the work schedule.
Okay.
That's what the 40 hours is.
So it's a good thing.
It's a good thing for the employees, but I still think that doesn't help with reducing the risk of exposure enough. You're still, when you have an office full with 10 people working there, and maybe 8 of those could have been working from home, that would be a better route for me. And that's why we continue to say that that he needs to let the people work from home that can work from home. So, I mean, it's just, to me, he continues to stick to that, wanting everybody to report. At least that's the email that he sent, and that's unacceptable with us. 100%. I do have a question for Dr. if you don't mind. What about what about contact trace for the positive cases? Because they're keeping everything very hush hush, and a lot of people are scared. For example, if if the person was positive and they don't know who it was, how do they know that they didn't talk to them on the way up in the elevator, or when they were passing by in the hall and had a conversation? So they don't have to review all of that or reveal who it is that came out positive.
That's a really great question, Ms. Ida. It is right now the county health department they're using epidemiologists to do contact tracing. My suspicion is that that department is grossly understaffed right now because of the outbreak, and if they're not understaffed, they're overutilized and fatigued because there's just so much action going on there right now. So I'm not sure how they're doing it on a countywide level, but I think their expectation from the county is that there be protocols in place from business to business, including BISD, and each school individually on how to deal with positive cases. So they're probably deferring to CDC guidelines to say, hey, if you have someone that's a positive in your building, this is what you do. Go to the CDC website and follow the protocol there. They're probably assuming that's what's going to be done. And I would say that's a good place to start. But there may be unique circumstances where we may need to say that there is something to do more so than what the CDC does because of our special circumstances. We may not be able to follow the protocol verbatim depending on the circumstance involved. So we do need to look at all those protocols as a school system and each individual school, and make sure that they're applicable to you, number one, but also that there are no other situations that could be potential barriers to giving the best care to keep everybody safe.
Thank you.
Okay.
Dr. Saavedra, any last words today?
I just want to thank everybody that continues to listen. I think that the community and the RGV is an amazing and resilient community. We've probably been through many things before as a community. This is probably one of the most trying times. I want to encourage everybody to just continue to remain positive, pray a lot. I also, before I go, because I forgot to mention this while I was discussing the other things, for anybody that's positive in your house, if you have one family member that's positive, you have to assume that everyone needs to get tested, or at least for a lot of families that they say, oh, well, mom's sick, but I'm not, I'm fine. We don't know that they're asymptomatic carriers. So do be careful to make that assumption, because you would be wrong about that. So please make sure to, if one person's potentially positive, you have to assume everybody is, and either isolate or at least test the entire house so that everybody remains safe. This is the only way that we can really understand if we are spreading the disease. So test early and test often is a really good strategy. And for those, because I did see somebody really early on that asked a question, for those that are wondering, my practice is called True Health Family Clinic. For those that are interested, we'll be starting telehealth services in late August of basically in another month maybe. And we're really looking forward to serving the Brownsville community and greater, because, well, with telehealth services, we have a broader scope. So we love you guys, and we're very happy to take care of our BISD teachers, staff, and the community at large.
Well, we're welcome back to Brownsville, Dr. Saavedra, and I know because again I'm fairly well in tune with that community, and my community is very, very excited that you're coming down and anxiously waiting August.
Yes, awesome. I miss my Brownsville people. Can't wait to be back.
The last words.
just continue to hang in there. I know it's getting tough, and it seems like, we keep getting one setback after another, but we're going to continue pushing forward, and we're going to continue to upset people as long as they're making the wrong decisions, and it's not in the best interest of the employees and the community. So we're just going to continue to do that, because that is what is right. And if it offends people, then so be it. We can't apologize for that. That it's only right to do this, because one life was one life too many, and it's heartbreaking to see that it's gotten to this point. And so we just got to continue to push forward. I did see one of the questions. They had a question about returning back to work, but they were a positive case. They need to contact Monica at HR, and she will guide them through the process of getting cleared to be able to return to work.
Thank you. Well, thank you again, Dr. Saavedra. Again, you're a jewel. Thank you again, Ida, for everything that y'all are doing.
Thank you. Thank you for having me, and thank you for all of what you guys do for us in the community. You guys are awesome. Thank you, Ida. Thank you for what you do for the teachers.
Thank you. Thank you.
Thank you.
We'll continue.
And Ruli, welcome back to Brownsville, Ruli, from your extraneous vacation. I am awaiting my souvenirs, Ruli. Guys, we love our district. We love BISD way too much to let it falter, to let it fail, to continue to see our amazing personnel succumb to this horrible, horrible virus that our doctors and our frontline staff out there are fighting on a daily basis. We love our district way, way too much. We love our BISD way too much to let it falter and let it fail. We love our community here in the city of Brownsville, guys. Please, I continue to encourage, if your neighbor has tested positive, your family member, please don't let them go out. Please go get groceries for them. Please go pick up their meds, help them out, help each other out. We are in this together, folks. We are in this together. We are Brownsville. We're Brownsville strong, and we'll come out of this intact. So please, guys, please be good to each other, and please continue to be good to me. God bless. Hasta mañana, 9 o'clock in the morning.